Epistaxis, the definitive guide to prevention, home management, and emergency triage.
Nosebleeds, medically known as epistaxis, are especially common in winter, and there's a clear reason why. Cold outdoor air combined with dry indoor heating creates an environment that strips moisture from the delicate lining of your nose. This dryness leads to cracks and irritation, and because the front part of the nasal septum contains a network of fragile blood vessels called Kieselbach's plexus, even a minor disruption can cause bleeding. Risk factors like frequent nose blowing from colds or allergies, nose picking, particularly in children, and the use of blood thinners only make nosebleeds more likely.
Fortunately, most of nose bleedings can be managed at home. Start by sitting upright and leaning slightly forward. Never tilt your head back, as that forces blood down your throat and can lead to swallow blood, which could be dangerous. Using your thumb and the index finger, pinch the soft part of your nose, not the bony bridge. Hold steady, constant pressure for a full 10 minutes. Set a timer and resist the urge to peak. For an extra boost, apply a cold pack to your nose or cheeks to help your constrict the blood vessels. Care after bleeding stops. Once the bleeding stops, avoid blowing your nose for several hours and be very gentle afterward. To aid healing, apply a small amount of Vaseline ointment inside of your nostrils. Use a humidifier at night. Stay well hydrated. And if you tend to pick your nose, trim your fingernails. It truly makes a difference.
However, certain red flags warrant a trip to the emergency room. Seek immediate care if bleeding continues for more than 20 minutes despite proper pressure, if you find yourself swallowing blood while leaning forward, or if the bleeding is very heavy. Also be alert for nosebleeds following a head or facial injury, any accompanying feelings of lightheadedness, weakness, or faintness, or if you take blood thinners and the bleeding won't stop. Finally, if nosebleeds are frequent, unexplained, or progressively worsening, do not ignore them. Get medical attention. To summarize with this epistaxis decision-making algorithm, when a nosebleed occurs, the first step is to assess for any red flags that require emergency care. These include heavy trauma to the head or face, feeling lightheaded or faint, or uncontrolled bleeding in someone taking blood thinners. If any of these red flags are present, the patient should go directly to the emergency room. If no red flags are present, proceed with the 10-minute protocol. Lean forward slightly to avoid swallowing blood. Pinch the soft part of the nose, not the bony bridge, and hold continuous pressure for a full 10 minutes without peeking to check. After 10 minutes, evaluate whether the bleeding has stopped. If bleeding continues, return to the red flag assessment or seek medical attention. If the bleeding has stopped, move to the aftercare toolkit. Apply a small amount of Vaseline ointment inside the nostrils to keep the lining moist. Use a humidifier at night to add moisture to the air. Stay well hydrated and trim fingernails, especially for those who tend to pick their nose, to prevent re-injury.